Thank you. And then there are some people in the waiting room too. So Andy or Naomi, if you could please monitor that, that would be great. Thank you. Thank you. Excellent. Okay. Oops. Oh, this is why I'm not good at slides, you all. Okay. There's Grace. I think we'll wait just a minute so we can get everyone here that we need to get here. Okay, let's try this again. Hi, everyone, welcome. I'm Dr. Jody Early. I'm a professor in the School of Nursing and Health Studies, and welcome to those who are just joining to our third annual, dare I say annual, HS alumni panel. This is our biggest alumni panel yet, and it really is such a treat to be able to see so many familiar faces come back. And I was actually shocked that all of you said yes. So I over thinking that we would get some no's, but it's so great to have you here, and you're representing so many different health professions. And coming through this program at Health Studies, the program allows you to really use what you're learning in this program to springboard into a lot of different areas of health. And some of you today are going to talk about maybe you landed somewhere that you didn't expect that you would be. You come in with a particular idea about maybe what you want to do, and then as is quite normal, over the course of your degree, you might have sparked a different interest or idea, or maybe you start off in a particular setting, and then you realize that you may or may not like that setting, and so you go into a different setting. So I think we're going to hear quite a few of those stories tonight. So welcome. I just want to take a minute to also thank the Health Studies Student Association officers who are here with us tonight. And so if you'd like to wave Andy, and Andy, why don't you just go ahead and introduce yourself and what role you have in HSSA?
Awesome. Nice to see you guys here, everyone. My name is Andy Pham. I'm a current junior at UW Bothell, majoring in health studies with minors in global health and health education and promotion. And I am the current treasurer of HSSA.
Super. And then Mohammed, are you with us right now? Would you like to say a welcome?
Hi everyone, my name is Mohammed and I'm a senior. I'm the president of Hausa. Thank you all for joining. I really appreciate it. I'm very excited for tonight.
Excellent. Thank you so much. Naomi, do you want to go next?
Hi everyone, my name's Naomi. I'm a senior at UW Bothell, majoring in health studies with a minor in health education promotion and also global health. And I'm the director of marketing.
Thank you, Naomi. And let's go next to Evan.
Hi everyone, I'm Evan. I'm a sophomore at UW Bothell, also majoring in health studies, and I work along with Naomi as the social media officer.
Great, thanks. And then Kaylin.
Hi everyone, my name's Kaylin. I'm a senior here at UW Bothell, majoring in health studies, with a focus in biology.
Great, thank you, Kaylin. And then Leanne, are you with us?
Yeah, hi, I'm Leanne. I'm the vice president. I'm a health studies major, minoring in biology, and I'm pre-med.
Great, thank you. All right. So a little icebreaker tonight, and you can put this in the chat because we don't have this in a poll, but we're interested to know a little bit more about your interest or expertise. So some of you are joining and you're already, you're already established, you're already in a particular area of health, but in the chat, just let us know, like, which of these areas best describes maybe a trajectory for you or your current role. And we'll be revisiting this during the breakout sessions later tonight. So if you're working in a healthcare setting or more clinical setting or a nonprofit, which also includes some non-government organizations, maybe a global agency, then we have government, state, county level agencies. If you want to go into research, maybe work at a school or university, global. Let's see what let's see what interests you or what you're doing right now. And I cannot see the chat, so I just realized that. So hopefully you're putting your answers in the chat, everyone. Okay. All right. We are going to turn just a little bit about um, tonight's alumni panel agenda. We'll have a land acknowledgement by Kaylin. Then we will. I want to recognize our colleagues and staff who are also attending tonight. And then we're going to have our presentation of the panel. But for now, we're going to turn the time over for Kaylin for our land acknowledgement.
Hi, everyone. So today we are virtually coming together from across the Puget Sound region, and we want to take some time to recognize and honor the resilience of Indigenous nations whose lands continue to be occupied. As we continue to read the land acknowledgement that we have prepared, please take a moment to look at the regional map that will be on the next screen, and please share in the chat the ancestral lands you live and work on. We acknowledge that we live and work on the unceded ancestral lands of the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Snohomish, Tulalip, and Muckleshoot nations. We pay our respects to elders past and present. Let's please take a moment to pause and to reflect. We are adding additional resources in the chat.
And we'll do that in just a minute. Thank you so much, Kaylin, for that. Okay, we'll move on now to, I just wanted to take a minute and recognize the presence of some of your professors or former professors, colleagues, and staff who are with us here tonight. Thank you so much. I saw Dr. Lasker. I saw Dr. Runderstorm here. I saw Kristen Lebrecq is here, our health studies advisor. Caitlin Wolf is here. If I miss you, my apologies, but I just want to say thank you for taking the time to be here tonight. And there'll be a way also for you to contribute to our conversation. So around 8 o'clock or 8:10 at the latest, we will have breakout groups. You'll see a breakout. Everyone will be able to choose the breakout session that they'd like to go to. So if you're joining as a faculty or staff member, if you maybe join the breakout where if you've worked in a particular sector or you have more expertise in an area that you join and can join in that conversation. After our breakout sessions tonight, we'll come back and we will wrap up. We also have a drawing, so we'll do that at the end of the night as well. Andy will talk a little bit in a minute about what that drawing is for. Right, Kaylin, do you want to take it from here?
Right, we're going to do our panelist introductions now. So the first person that will be introducing themselves is going to be Hannah Burke.
Hello, everyone. It's great to see you all tonight. My name is Hannah Burke. My pronouns are she, her. And to give a quick visual description, I am a white woman. I have long brown hair. I am wearing a light blue top and green glasses. And I graduated in 2021 with my health studies degree and double minored in global health and health education and promotion. And I am currently a public health coordinator fellow working within the Department of Health, the Department of Health's Office of Public Affairs and Equity, as well as the Office of Nutrition Services SNAP Ed evaluation team.
Great, thank you so much, Hannah.
All right, so our next panelist is going to be Marisol Bajarano. Sorry if I mispronounced that.
No worries. Yeah, so my name is Marisol Bejarano. My pronouns are she, hers, and I graduated in 2020 from the University of for University of Washington, Bothell. And I am actually currently finishing up my master's in health leadership from Western Governors University. Currently, I'm actually working at a nonprofit organization in Linwood called the Latino Educational Training Institute, and I am currently the director of health and wellness programs.
All right, thank you. Our next panelist is going to be Sonora George.
Hi, everybody. Thank you for being here today. So my name is Sonora George, and my pronouns are she, her. I graduated from UW Bothell in 2018, majored in health studies and minored in health promotion and education. I currently am a student at the University of Utah's Physician Assistant Master's Program. And formerly, I was a health educator at CMAR Community Health Centers for 3 years. And I wanted to share a little bit about myself, that even though I'm in grad school, I still really do enjoy snowboarding. It's become one of my favorite hobbies.
Thank you so much. Our next panelist is going to be Ray Gonzalez.
Hey, can you guys hear me?
Yeah.
Hello, my name is Ray. My pronouns are he, him. I graduated from UW Bothell. Man, that was a while back. 2018 with health studies. And then after that, I went to get a master's degree at the main campus to focus more on health informatics and health information management. And I graduated from there 2020. No, I'm sorry, it was 2022. And then I graduated from UW Bothell 2020. So right now I work at UW Medicine as a health information technician. And currently I'm trying to see if I can move into IT, but I'm still trying to explore new new positions in healthcare. And something that motivates me every day, it's this quote that I wrote: everything happens for a reason. So I thought inpatient was gonna be for me, working with inpatients, but it wasn't. So I'm still learning about me. So everything happens for a reason. So yeah, that's me.
All right, thank you. Next, we have Kathy Lungrath.
Hi all, my name is Kathy Lungrath, she, her pronouns. For a visual description of myself, I'm a Lao Asian American woman with long curly black hair, wearing a long sleeve beige top with my bedroom as my background. I'm a first year MSW student at the University of Washington, and I'm currently working at the Washington State Department of Health in the Office of Public Affairs and Equity as part of the Pilot Workforce Pathways program. I graduated from the Health Studies program in 2020 with a minor in global health.
Thank you. Next, we're going to have V. May.
Hi, everyone. My name is V. Mai. My pronouns are she, her. And I graduated from UW Bothell in 2022 with a double major in health studies and science, technology, and society, as well as double minors in global health and health education promotion. I am currently a first year student in the Master of Health Administration program on the UW Seattle campus. And I am also the executive director of a local nonprofit called the Midwives Association of Washington State. And this summer, I will be an administrative intern at Seattle Children's Hospital. And my motto is the same as Ray's: everything happens for a reason. And I used to not think that way, but definitely learning to let the doors, open for myself.
Thank you so much. Now we have Annie Smith.
Hi, everyone. Good to be here tonight and good to see you all. My name is Annie Smith. My pronouns are she, ella. I graduated from UW Bothell, magna cum laude in 2019. Also had, with my health studies degree, also minored in health education and promotion and gender, women, and sexuality studies. And then went on to UW main campus, where I attended the School of Social Work and graduated with my MSW in 2021, and also received my nonprofit management certificate from Evans School of Public Health. public policy and governance. Sorry. I'm also a certified health education specialist, which is something that many of us work towards, and very happy to have. I'm currently a human services coordinator with a focus on equity for the city of Kirkland. And so about my motto, just being able to come into spaces, because something I've is very true, and I'm learning more and more, is that often we're not allowed to come in fully who we are and bring in all of our identities into the spaces that we occupy. And as challenging and as scary and as difficult as it may be to bring those identities, I think it's something that we need to do. So thank you.
Thank you so much. Next, we're going to have Brenda Solis.
Hi everyone, my name is Brenda Solis and my pronouns are she, her. I graduated from UW Bothell in 2016. I was actually part of the first class of the health studies program at UW Bothell, and I minored in policy studies. I graduated in 2020 with my master's in health administration from UW Seattle. I'm currently a health center administrator for CMAR Community Health Centers in Puyallup. I manage a medical and dental facility. And my motto has always been "Si se puede," which is yes, you can, or yes, it can be done. You know, as a Latina woman growing up, it was always told that I couldn't do things. So always living with "Si se puede," and, you know, just to elaborate, like everyone can do anything as long as they put their mind towards it.
Thank you so much. Now we have Calvin Trin.
Good evening, everyone. My name is Calvin Trin. My pronouns are he and him. I graduated from graduated from UW just recently, last year, 2020 or 2022, with a bachelor's in health studies and community psychology. Currently, I'm transitioning my role right now to working as a forensics clinician at Sound Health and a crisis intervention specialist at Crisis Connections. And a little bit about my motto is, even a happy life cannot be without a measure of darkness, and the word happy will lose its meaning if it weren't balanced by sadness, by Carl Gustav Jung, which basically resembles the yin and the yang.
Thank you so much, everyone, for introducing yourselves. That is all of our panelists for today.
Great. And we'll turn it over to Naomi, who has the first question for our panelists that all panelists will get to answer, and each one will have about 1 to 2 minutes for that. So Naomi?
All right, so our first question is, can you guys please share a little about your current role and how the health studies program has helped you prepare for it?
And maybe what we'll do is just go back to our order that we had for our panelists. So maybe we'll start with Hannah on this one.
Happy to start. So my role currently, I am a fellow through the Workforce Pathways program at the Washington State Department of Health, where the aim is for us fellows to gain professional development, community building within our fellow cohort, and having us work with an assigned host site. And my host site is situated within the SNAP-Ed evaluation team. An overarching project that I have been tasked with is helping carry out the WIC and SNAP-Ed statewide needs assessment. And to give some context, so Washington State Department of Social and Health Services, otherwise known as DSHS, receives funds for SNAP and SNAP education. I'll kind of be saying SNAP-Ed, which is short for SNAP education. And the goal of SNAP education is to teach SNAP eligible folks about healthy food choices within a limited budget and how to have a healthy and active lifestyle. And just to warn, so SNAP-Ed is separate from SNAP or EBT benefits, and is in DOH is one of 2 organizations that provide SNAP-Ed throughout the state. And basically, we are required to take on the statewide needs assessment for SNAP-Ed and WIC. And WIC again stands for Women, Infants, and Children in that program. So my main project has been primarily collecting feedback from WIC and SNAP Ed users throughout the state on these program services. And I think as far as preparation for my current role, having a solid background in public health, understanding those concepts and processes, especially within health education and promotion, just kind of knowing the landscape, especially when it comes to dealing with large programs. So like how to assess where improvements can be made. That has been super helpful. I also feel really grateful for the health studies program, all the great material and experience I gained. That has been really helpful for me as a fellow within the Workforce Pathways program. And again, that program is primarily built around expanding Washington State's diverse public health workforce.
Great. Thank you so much, Hannah. I can't wait till we move on into breakout rooms later to get to ask some additional questions. Marisol, do you want to go next?
Yeah. So I am currently the Director of Health and Wellness Programs at LETI, which is Latino Educational Training Institute. So I feel like there's so much like interconnectedness with like the way that I ended up at LETI with, being through the health studies program and, LETI itself. So actually was able to go back to LETI through one of my summer courses, through one of their expos. So that's how I kind of got reintroduced into the organization after, participating in some of their programs previously while I was doing Running Start at Everett. And so, the reason why I kind of feel like I was really being prepared for what I do now is the emphasis on community work, being connected with community, really kind of, knowing that we can't do all of this work by ourselves. So, I've been working at LETI for 3.5 years now, and I actually get to work with university students all the time now, kind of connecting them and showing them kind of how we do some of the things that we do. And that connection, I think, with different organizations is one of the biggest assets that I think that we all have. We all bring something. And so knowing that health is kind of in everything and understanding like, everything that is happening in somebody's life, everything that people are kind of experiencing is going to have an impact on their life. So kind of like what Hannah was saying, you have to kind of understand, what those people are experiencing, what are they needing, and then kind of really thinking about, well, who can help them? So, maybe you met someone at the university, maybe you met someone in a different organization, and being able to come together to help meet those needs, I think is one of the most important things that we do at LETI. So, yeah.
Thank you, Marisol. And then we'll go to Sonora.
Great. So I was thinking about how I was going to answer this because I feel like I have kind of two trains of thought, right? Is one with my being a health educator initially at CMAR. And I think that that program really set me up for success, and that just everything I did at CMAR in that community health center really came from all the things that I learned in the program. Like what was been mentioned before, working with the community, working with patients one-on-one, developing programs, all of those things were really implemented by myself in as a health educator in the clinics, and all of those things were learned directly from this program. And I don't think that I could have done any of it without that confidence of just practicing it before, being in groups and working with other people in the class. So that was what I was thinking in terms of my time as a health educator. Now, as a student, as a grad student, I think, of course, it's a little bit different, but I think I definitely have a lot of knowledge coming as a health educator that a lot of other people don't. There's a variety of roles that come into this grad program as a physician's assistant, and so I think for a beneficial part of it for me has been having that patient contact, that communication, being able to like assess communities for what they need and really bringing that to my group work in teams when we're talking to patients. You know, I'm in my clinicals. Our clinicals are coming up, and then I'm going to have I have my Friday clinics, and I've just been able to go in there and talk to patients so easily because I've just had all of this experience in the past. So I think those things have really set me up for success now. And I think it's going to set me up for success later when I'm working with my patients because I already have that in the back.
Great. Thank you, Sonora. Ray, do you want to go next?
Yeah. Can I see the question again, please?
Yeah, so talk about your role now and also how you think the health studies degree has helped you in preparation for where you're at or where you want to go.
Definitely. So the reason why I wanted to go for health studies in the beginning was because I wasn't sure what I wanted to do, in all honesty. So learning about public health and all the options that we have available, right, in healthcare, I wanted to see what I could learn from, right? And then going forward, I thought working with inpatients and just doing inpatient operations was my thing. I did that for a while, and then I came to a conclusion that maybe working with patients one on one or interacting with patients was not for me. I landed a job at Multicare as a supervisor managing the ED, the emergency department. And I was there for a couple months, but then I came to a conclusion that, hey, this is actually too stressful and maybe I could be doing something else that maybe doesn't have to be interacting with patients just because, you see things you don't want to see. And I'm a really sensitive person, so it means like I don't want to see that, right? So that's just me. Some people are stronger than others. So now I landed a job at UW Medicine, doing doing medical records, and I'm trying to transit into IT. So mainly what I want to do in the future, I just want to do something where I can work in a team with people and then just at the end of the day, I'm still helping out hospitals, helping patients, right? Helping everyone in a healthcare setting, but they just don't know who's helping. That's how I see it.
Thank you, Ray. Kathy.
Yeah, so formally, okay, I'm gonna touch on, so Hannah kind of touched on our program a little bit. The Workforce Pathways program, formerly we're known as public health coordinators, but more informally, as Hannah had mentioned, we are Workforce Pathways Fellows. I work mostly on the Workforce Pathways program, doing more administration things, but I also have joint placement between both the Workforce Pathways program and the Language Access and Accessibility branch. So with the Workforce Pathways program, we are intentionally investing in a workforce that is not only reflective of Washington as a whole, but really investing in lived experience. So we're trying to create a long-term and sustainable change through investing in strategies that will train, recruit, and sustain a diverse public health workforce. And on the language access team, I'm working on, for example, working on resource hub and like a site for the agency's external and internal publications, working to ensure that contributions being released to the public are not only representative of Washington's communities, but is appropriate and accessible to all. And I would say as the health studies program is so diverse and touches on all of the 10 essential public health services, it's really helped me to excel in governmental public health now, especially as I'm transitioning into working with within legislation and policy to advance workforce equity in Washington state and start to begin writing the agency's language access plan. Yeah.
Great. Thank you so much. And V, you're up next.
So kind of in the same boat as Nora, coming from a work background as well as grad school. Through my work, I actually was connected to the Midwives Association of Washington State through one of my courses in the health studies program as an intern. And then I was connected with them again when they were hiring for an executive director, and getting that education piece of my minor and working with, you know, diverse groups of people in the community as well as in the classroom really helped me to work with the board of directors. For example, we just went through a board change. So that's a, you know, there are a whole different type of people that I have to navigate and work with. And then reaching out to our community of midwives and consumers and learning how to provide education to them, as well as coming from a background where I'm not a midwife, but I still have that knowledge, that public health knowledge. So that's what I really took away from the health studies major. And then as a grad student, it is really interesting coming from UW Bothell because I'm the only person in my cohort that came from UW Bothell. And with the health studies background, I feel like I have an advantage to where my classmates from, you know, across the country, some international, and some just from UW Seattle doing their undergrad, but they didn't get the diversity and the level of like cultural education and like community work that we did. And so a lot of them struggle with connecting to our communities that we work with, but that's not a problem for me because I was so exposed to that in this major. So that's something that I'm really grateful for.
That's really powerful, V. And I just wanted to say too, it was through your fieldwork, right, that led you to your the executive director position. Is that right?
Yes. Yes. Oh, and now I manage fieldwork students myself.
Yep.
So yeah, full circle.
Exactly. And there are some too I know who are doing the same. So V, this is great for all of you who have yet to take field work. I just want to tell you how important, how powerful that experience can be. So thanks. Annie, we get the spotlight to you next.
Wow, I get to see my giant face on the screen. Thanks.
It's a beautiful face.
So currently I am, and since 2021, I finished up my last quarter at UW Seattle in the MSW program, and also was working for the city of Kirkland in my current role as a human services coordinator with that focus on equity. It was a new role that they created, so I'm the first one. So the amazing part of that is it's kind of a blank slate. I don't know that they really had a plan with my position. And so that's the great part of it. And I have lots of ideas. So our division is housed under Parks and Community Services, so which is kind of a weird place. But we really do get to be kind of the touchy-feely part of government as much as you can within all of that red tape and bureaucracy. So, you know, I will say for me, and this is like comes up over and over again, the thing that I took away from the health studies program and the health education and promotion work, even more specifically, is to V's point, how we're engaging with community. Because I think you will learn, if you haven't already, in theory, what we learn isn't usually what's in practice. So centering community, centering voices, we have a lot of, I have come up against a lot of very paternalistic ways of doing work, and that you know is, you know, what can we do for you, and not including folks in that co-creation and in that conversation. So for me, I think, and even more so than any of the textbooks, I mean, we had great textbooks, but I mean, from the instructors, from our professors, learning how to do that in practice. How do we engage with folks? so that we're not coming to them with an ask every time they see us. It's to ask something else, right? It's like, how do we create relationship? How do we engage with folks and have a meaningful relationship with people and have conversations? So for me, it was that critical piece of like, how do you work in community? And you will see that not many folks know like that's a really hard piece. And I would say you can be taught that, and there's also something in you that makes you that type of person that can do that. So anyway, that's me, and thankful for my time at UW Bothell.
Thank you so much, Annie. You've got so many great things that you're doing, and look forward to digging into those even more as we go on tonight. Brenda, it's time to put the spotlight on you.
So I graduated in 2016, so it's been a little bit of a time, but as far as the health studies program and how it correlates to my work now, I met Dr. Victoria Breckwich Vasquez my second year in the health studies program. And actually, she's the one who kind of mentored me throughout my whole journey in my career and within getting into grad school, and then afterwards now in my current role as well. So I met her, she was a guest speaker at the time, and I think now she's part of, I don't know if she's still a professor with the program, but she was really an important role. And that's where I actually met Jody as well, when we did field work with her as well. But Victoria really connected me with different aspects of the community. She got me summer internships at UW Seattle. Within the community, she introduced me to CMAR. She had connections within CMAR, and that's where I was introduced when I graduated my health studies program to become an executive assistant for the administrative department with CMAR. And then that's where I kind of developed the keen interest in health leadership and management that I had been introduced in the health studies program. Since it's so diverse, you learn about management, leadership, community, public health. I had the concentration in leadership and management. And Victoria actually helped me with my application to the UW MHA program. And when I was there, I kind of all the experiences from the program beforehand at UW Bothell really helped me. Kind of similar with V, I was the only UW Bothell alumni that was in my program. Everyone else was usually from like UW Seattle or out of state. So my close-knit program really helped me navigate within the UW MHA program, since we are with a small cohort, about like 30 students. And we are with each other for 2 years, essentially. That's kind of the same thing that I had at UW Bothell. Most of my classes were 30 students at the time when we first started in 2016. So it was very similar aspect. And then now in my current role as a manager, I came back to CMAR because I have enjoyed working with the community. The aspect of being able to serve patients that look like me and help them and be able to speak in my native language has always been really important to me. So that's something that I have taken from the culture diversity that UW Bothell offered me, and then taken that into my career at CMAR as well.
Great. Thank you so much, Brenda. And Dr. Breckwith Vasquez is very much still with us, although she is going to be moving to California. But yeah, she continues to mentor and to do all of those great things that she does in the community. Calvin.
Yeah, a little bit about my work. My job title entails it's a crisis intervention specialist. So basically, I work at a crisis clinic, and one of the few roles I do is that I supervise phone workers that are generally having calls with individuals that are basing on their acuity assessment on whether or not they need emotional support, they need additional resources to get navigated in the right direction. And along with that, there's several different types of like work desks that you would work at. So there's a section where you work with the DCR, which is a designated crisis responder, and you basically navigate and you send them out to places where individuals actually need to get a mental health assessment. And so along with that, I work in the mental health system, and then I guess in the system, I guess what you would say. So I would basically, if that proceeds, I would basically move on to trying to get the people that need involuntary treatment to be checked into a hospital. So I'm coordinating with all kinds of hospitals like Harborview, Navos, and whatnot to make sure that they have a place to stay during that time. So it's a lot of like administrative work and just following through with a lot of plans. But aside from that, I think something is that I joined a research lab 4 months ago, and I'm just excited because I just found out yesterday that I've been working on the systematic review for 3 months, but I was actually able to get co-authored on it, so it's really exciting for me. So, yeah, it's a little bit about.
Exciting. And Calvin too, I would say that you're involved with so much, but like many of you here in this panel, you go beyond to extend your learning. Calvin, you did that with the Peer Mental Health Navigator program that I'm helping to co-lead with a whole team out in the community. And it's through that work too that you're connected to Dr. Lucia Magis Weinberg that has a lab. So I think I think one of our themes tonight is the work that you get involved in outside of the classroom is just as important in terms of the doors that are opening and the pathways that you take. Did you think, Calvin, when you entered health studies that you would be pursuing a career in relating to mental health?
Actually, I was falling more on like the physical health component side, but now more recently I've been kind of stepping back a little bit more, taking a more a holistic approach. So I've been kind of on that ecological model of just taking it from a holistic approach.
Well, great. Thank you so much. And Andy, I'm gonna instead of sharing, well, why don't you just read the question and then we'll spotlight people again. That might go better.
Yeah, I'd like to open the floor to 3 more panelists. We'll keep these responses to about 2 or 3 minutes for the sake of time so we get opportunities to talk in break rooms. But yeah, just hindsight is usually 2020, looking back to your time in the program, kind of think about what you're doing now, kind of like how we were talking about it earlier. Was there like a particular moment where you're like, aha, or like a lesson learned that you found meaningful to do the work that you're doing now that you'd like to share?
And panelists, just to give you some time to think about it, if you want to use your raise your hands, that might be helpful too, or feel free to unmic.
Yeah, so I just recognize I didn't fully talk about the actual work that I do and just how great the health studies program was. So part of the work that I do as a coordinator is I do community outreach to get to know nonprofit organizations, particularly small organizations and BIPOC organizations, and really to create relationship. So also as part of that, I think with the equity title, oftentimes, a lot of departments within the city are pretty siloed. So they don't really know what we do. And they're like, oh, equity. Yeah, oh, she must have know lots of folks who are people of color and, she can get us contacts. And that's really challenging because I will tell you of this experience. So part of what we do too is manage contracts with nonprofits. So we get lots of funding and then we contract with nonprofits to provide services. So I like to tell people what we do is we support community to do the work that they do, that they're experts at, right? We don't try to oversee that work. We're just providing opportunity the best we can in the most equitable way. And there's lots of stuff with that. So someone reached out to me and said, hey, we need someone for this focus group. Can you give us some of your contacts? Can you reach out to folks? And I'm like, sure, right? I can do that. And I went to an organization that happens to be a Latinx organization that does outreach work in the city of Kirkland, and said, hey, folks are wanting to talk to you and have a focus group. How about that? And they're like, and I was humbled in the best way. And this also was a really good example of, even though we may be part of a community, we also, I think there's oftentimes we're indoctrinated into that same very white-centered way of doing things. And it's really hard to break that. So they were like, hey, why is it you always come to us in the middle? right? You're not making a relationship or trying to have a relationship. You come to us and ask us for things. And also it's, you know, it's transactional, but not always like we're not being paid for our labor or our expertise or our knowledge. And I was like, you are so right. And since that moment, like that is a thing that I should have just known. And in my, you know, zeal to get the thing done and impress people and do the thing that I was being asked, I forgot the humanity of the folks that we work with. And so ever since then, that's been one of my, so I think that was my aha moment, was that, look, you know, the best I can do in the position I hold right now, as scary as it is sometimes, as challenging, is to be a disruptor and to push back on the ways that have, it's always been done that way, right? I have the privilege of being able to do that because of where I'm at in life. Not everybody has that. So anyway, that's what I have to share.
Incredible. And it's also those ahas can come every single day, right? And as part of our own development, they should. Yeah. So thank you for sharing that, Annie, for being vulnerable to talk about that. It's an important reminder for us all. Other panelists, any ahas that you've had that you think could be helpful in sharing about, you know, an aha that you've had that has led you to maybe make decisions about the work that you want to do or your current position, or something that an aha you had that where you learned you didn't want to do something. Ray, I think I heard you say that in the very beginning. If you want to share a few words.
Yeah, I mean, something I can say is you know, you can always reach out to like people that you know, like from school or like people you met. So network is really important. For instance, in my case, when I was at multi-care, I was really stressed out. I was like, yo, I just got this new job. They threw a lot on my plate. I'm not sure what I'm gonna do. I don't want to stay here. It's too stressful, both mentally and physically, because I had to be there almost 24/7. So what did I do? I started reaching out to people that I went to school with. I'm like, hey, you know, I know we didn't really talk much, but like, you know me and I know you from school. So what are you doing? Can you like help me out, like find a new job? Maybe it's not something I want, but it's something in the field. And then from there, I get to learn and experience new things. And eventually I'm gonna find my way to where I wanna be in 10 years from now.
Such a good reminder too, Ray, that those connections that it's been hard too with the pandemic, for some, especially that haven't been able to necessarily physically be in class together. We've been getting back there, but the relationships that you've developed, and you know, it is amazing how those become your networks later on. You may not even realize it. And I've also seen the power of this alumni panel, and how many individuals, when they're attending this, they'll write down a name, they'll send an email, they'll be connected to their next position because of this. So thank you for putting that in the spotlight. Any other lessons that panelists that you want to share or ahas before we go on to the next question?
I can talk a little bit about, I guess, the networking piece. I think, you know, it's such a full circle moment, I guess, you know, being a student and then being able to give back. But something that I've kind of it's always stuck in my mind is like, it's not what you know, it's who you know. So being able to connect, you know, with people and really make a genuine connection, because like Antoinette was saying, was sometimes we get used to like the transactional piece, but sometimes, you know, we want to get to know what people do more than just what their job is, because maybe they have previous experience that gives them something else. You know, they have these other skills that we can, you know, connect with and give the opportunity to explore those things. I think you know, something that I've always learned is you're not going to know what you don't like until you try it. And so I always tell everybody, if you don't know what you want to do, like just volunteer, go do something. And for me, like when I first started kind of at University of Washington, I wanted to be, oh my goodness, what was it? An anesthesiologist, because that's what made money. And, I wanted to make some money. So that's kind of where I was. And they're like, maybe you're not in the right program. But as I got into, my public health class, it was Public Health 101. I was like, wow, like this is so interconnected. Like I want to work in this field. And it's such a big field. Like you could literally do so many different things with like this degree. So it's kind of hard to kind of pinpoint what you want to do, where do you want to work. So, it was one of the reasons why I ended up at Letty, is because, for me, education is really big. And being able to work with, the community that I grew up in, and especially, being the daughter of immigrants, I'm able to connect with people that I feel, connected to, and like I understand like their struggles. I understand, what they're going through, and being able to give back, and doing it with the help of others that have that type of experience. So it's always an aha moment, like Jody said. We're always learning, and you always have to be open to learning, because we're always going to be growing, and things are going to be changing, and hopefully in a good way. But yeah, there's always room for growth, and there's always room for more connections. So yeah.
Marcel, I just need to take a moment to publicly just say how exciting it is to see you, like having you as a student in a class, or doing some community-based project, but then going to an International Women's Day celebration in Linwood that you create, like you put together, and seeing you up there leading, it is just amazing and inspiring. And the work that you're doing, not only with our communities, but with our students. And I just gotta say, I'm so excited that I get to continue to work with you, but in a different capacity now, and as a community organization with another one working together. It's really, really powerful and fun. And, so many of you on this panel, the same thing, whether it's CMAR and getting to see how you are inspiring working with students, or Kathy and with Hannah working in public health. And, it's don't think that I haven't already thought of how we might be able to create some fieldwork positions with you, and this fellowship that you have. And so that's really special too.
Okay.
Thank you. And I think now let's move on to our last question before breakout groups. And Evan, you've got this one.
I do. My question for the panelists, or like 2 to 4 again, is what advice do you have for current health study students preparing for life after UW-Bothell and working in healthcare professions?
I did want to say something about this one, if I can go first. That's okay. I think what a really big thing for me that I think I was worried about when I was in this program was a lot of my classmates were saying there's nothing to do with this after you're done. And they kept saying that, and I kept getting nervous, like, wow, I just invested this time into this. Like, what am I going to do? And I wanted to just reinforce the comments that were made before about networking. It doesn't even have to be too far out. You know what I'm saying? Like, I think like even just having these people, these names in your bag is really important. Like the position that I got as a health educator at CMAR, I got from knowing my sister who works in the healthcare world. She was like, oh, I know a doctor who works there. During my interview, I mentioned Jody and I mentioned Vicky, and the person knew them, which turned into my job there. And then the medical director there said, you should be a provider, which led me to PA. So I think like it's really important to remember that like networking doesn't necessarily mean meeting in person all the time. It could just be knowing these people, making these connections, and being able to use them as your references, like and getting a little bit out of bounds. And it doesn't necessarily mean like everyone said, there's so many different options for where you can go with this program. So it doesn't have to be just one thing. It can lead to many things. You know, I thought, oh, I loved my job as a health educator. I didn't want to leave to go to grad school, but I knew this is where my path was going. So it's just things can take turns no matter what.
Thank you, Sonor. You know, I also want to say to you and to others that you actually leave. This is going to sound cheesy, but it's real. You leave not only your footprint, but you leave your legacy. And by doing that, you open the doors for others. So, for example, because you did such an amazing job at CMAR, and I talked to Rogelio Reyes, who's on our board, and he says, I love UW Bothell students. We want to hire UW Bothell students. So now anytime I write a letter of recommendation or someone else writes a letter of recommendation or they see UW Bothell, they think about those students. So you are, you know, all of you are leaving that footprint for someone else and that door that you're cracking open for them. So thank you so much. Any other panelists wanted to talk about just a lesson that you, or some words that you want to share with this group?
I can go next. I think in terms of like your time in the health studies program, you really get out what you put in to the program. So, you know, make sure that you are making those connections like everyone has been saying, whether it be with your classmates or your professors, or like people, you know, in the field work, when you do your field work course, or like community engagement courses, because yeah, like those connections will come in handy, even if you know, just keep in touch and see on their social media or something that they are hiring. And you know, that's actually how I got my job. So that is like the biggest lesson is, you know, you get out what you put in. So put in like the time and the energy, and the professors, especially in the health studies program, all of my professors, I am really thankful for, just because like it is a smaller class. And so they're able to focus on you as an individual and like uplifting you. And all of the professors that I had really cared about my professional and personal growth. I remember like starting undergrad, I was super shy and like you know, scared to speak out in class, and that's still something that I'm working on. But I think that a lot of my professional and like emotional intelligence and the growth that I've had has come from my professors. Yeah.
Thank you. Anyone else on our panel have some, you know, just some thoughts or some nuggets of wisdom that you want to share?
Like something I can say real quick. If you're thinking about going for a master's, don't be scared. It's not what you think. I mean, don't get me wrong, it's hard, but you can do it. Just keep that in mind.
That's such great advice. And I also want to say that so many of you do have your master's degrees. We will have a breakout if that's your next step and you want to talk to some alum about that. We're going to have a breakout in a minute. So I know some of you here that are plugged in, you've already gotten your offer letters, your acceptance letters, and you're making decisions. So it's a very timely, some of you were accepted into our Masters of Science in Community Health and Social Justice. And so you might be trying to decide if you're going to go to our program or if you're going to go to the MPH. And I think you've heard some good advice here tonight about all the community types of projects that, and what you learn, Annie, what you said about really learning how to work with the community and not just in the community or take from the community is something that I think we really try to focus on in this program. Any other thoughts before we break out? Okay, we're going to try something this year that we haven't tried before. We want to give people time based on their interests, based on the sector they think they might be next interested in moving into, to spend some time with our panelists and faculty and staff that are joining. We'd also appreciate you joining one of these breakouts too, that you think you can contribute in the conversation and the questions. We're right on time, so you guys are awesome at keeping to our time. We'll break out. You'll be able to choose these breakouts. So let me put these up. When I push the rooms open, there are 4 rooms. We've got one for healthcare, one for nonprofit or foundations, NGOs. We have one for government, state, county. So if you're thinking about public health, that's the one you want to go in, is room 3. And then room 4 is for grad school. So I'll go ahead and I will open these up, and I will give a 1-minute warning around 8:15 or so, and we'll come back together, and then we will see who has won our drawing tonight for a health studies t-shirt swag. And if you get done earlier, you can also come back to the main room where I'll be. So all of you should be seeing now these 4 rooms. Do you see the 4 rooms, everybody? You should be able to pick your room. And if for some reason you can't pick your room, just come unmiked and tell me which one you want to be in, and I'll put you in that room. I did do a drawing, and Naomi, I will go ahead if that's okay, because I probably will take me longer to just send you the name than just announce it. But I wanted to announce that Emily Munn. Emily, where are you? You have won a health studies t-shirt that you get to pick out, and we will connect you with our director of academic services, Clay Schwinn. You can pick it out. And so you wear some swag and represent our school, but congratulations.
That's awesome. Thank you so much.
You're welcome. All right, next, we just have a couple of messages from our Health Studies Student Association officers. So I'm going to share screen again for just a minute, and let's see. You all bear with me as I get to the right slide. Yes, so here's your slide, Emily. Congratulations. Oh, before we get to our officers, though, I did want to just remind, if you're listening to this recording or you're here live, we do have a Community Impact Award for Health Studies. And Annie was actually our very first Community Impact Award winner. Do you remember that, Annie? Do you remember that award? Sure you do.
Was it? Yeah. In our yeah, yes.
And you actually helped us conceive this award. So this is an award that goes to so if you know someone or you yourself are doing work in community, please nominate yourself or nominate somebody else. It's a very short form. And Caitlin, do you mind putting the link in the chat? I realize that no one can click on the slide, but later on we can send the slides out if people want them. But please do nominate. And the nomination, I think they close on the 5th. Is that right? Yeah, on the 5th. Okay, and then I'm going to turn it over to a message from Andy and Evan about the HSSA Association.
Yeah, no problem. I just want to say thank you to everyone here who came today. It's been such a very interesting and very learning environment where I can just absorb all this information about, the health studies department. And even then with future careers, I know I can speak for everyone here that's been a very valuable experience. And I guess I can introduce the topic of just HSSA recruition and just basically highlighting that, hey, we're taking members and we're looking for officers as well. So if you are interested, I'm looking at, anyone here who is in the health studies department or even not, if they're interested, if you want to email me, Dr. Early, Mohammed, about being interested in the club for next year at all, yeah, we'll take anybody, and we'll have select emails regarding, officer positions. But yeah, Evan, you want to add anything else?
Yeah, I'll put my email in the chat. Feel free. I'll put a lot of different contact information. Feel free to shoot me a message if you're interested. It's a great club to be a part of. A big theme of tonight was networking, and this is a great way to network with people that might want to go into different career paths for healthcare, and it looks good on the resume. I mean, it's a club officer position if you're interested in just being a part of it. You know, you get to meet new people and experience new things like the alumni panel and have a lot of fun. So if you're interested, go ahead, contact me and Andy or let a friend know. We'd love to have you.
Thank you so much, Andy and Evan. Appreciate that. And for all of the HSS officers that are here and have helped to make this night what it is. And for those graduating, let's put our little emoji clap hands for you. You made it. Only a few more weeks and we're going to be seeing you cross that stage. And who knows, maybe you'll be back. And this time you'll be on our alumni panel, or maybe you'll be in our new master's program. But we'll see. I'm sure we'll see you again. So exciting. I just wanted to say thank you to our panelists who were here tonight. While you all were in breakouts, I was telling my colleagues that I was trying very hard not to cry, because hearing your stories and just knowing what you're doing, you are truly inspirational, not only to, our attendees here, but also I think to faculty and to staff who, sometimes we dig deep because we're like, there's a lot of things going on right now, right? And especially in higher education. And it's nights like tonight that just like really fill our soul and remind us, why we're here and to keep going. So I want to thank you all for making it such a special night. I also just want to leave some time at the end. I think this is a first, man. We've left a lot of time open, but a time for if you wanted to get someone's email address, the chat works. You can private chat, or panelists, if you want to drop. I wasn't able to create a slide before this, and I also didn't know if you wanted me to send your email through the slides. So if you want to drop your email in the chat or your LinkedIn information, either one, I'm sure I'm sure many of our participants tonight would appreciate that. Also, just want to open up the floor if there are anyone has any comments. So faculty, staff, colleagues, students, panelists, if there's anything that you want to say before we break tonight, now's your chance.
Hello, my name is Felicity Abeda. I'm she, her, and hers. And I wanted just to call out, say hi to Brenda Solis. I haven't seen you in a while. And there's other people here too that I would love to call out, but Brenda, I've known since she's been 16 years old. She was in our high school program called UDOC, for it was a healthcare program at UW Seattle. And actually, Brenda, it's back. It's been back almost 2 years now, back at UW School of Medicine. And I was a part of that program there for a bit. And Brenda was part of one of the classes that I was coordinating over there. So it's just a really great opportunity. And Brenda, yes, I'm working with Professor Victoria right now on the LETI and the LLI, Latino Latina X Leadership Program and at UW Bothell. And it's just been such a great opportunity to be a part of, and working with Latina X students at UW Bothell. I'm a pre-major advisor at UW Bothell. I did get my MSW. I do work with health studies and recruit in an advising kind of way. And so it's just been really good to be kind of like a full circle right now. I get to see students I've been working with since 16, and also still planting seeds with students now. And it's really good seeing you, Brenda. Keep on going. Everybody, just keep on going. Do what you're doing. And to see Jody here. And right now, I'm just I'm getting over COVID. And so I'm not not turning on my camera, but I knew that I just needed to come on because Brenda also, she sent me something in the mail to say that she was graduating a few years back, and I still have it on my wall. It has definitely been a career change for me, to be, because I was at UW School of Medicine for over 12 years. So UDoc was the baby, like a baby program for me, you know. So and to see, and that same feeling that Jody has, just to see students grow, and also me, you know, just saying, okay, what am I going to do next, right? Where's my career going? Health studies has just been, it's such a great thing for students, and you know, they get to really find identity, and also really be and it works with your community, and you can give back to your community and make a difference economically, and it breaks the health disparities and the barriers, and so it just really does. So if you know, if you are looking into health studies, and you are a pre-major student, I'm always interested in working with HSSA to on how we can get pre-major to be, you know, I want them to see this video. I want them to be involved, and let you know, I'm always interested in finding ways on how we can do that. So and here it's an open door. I'm happy to have a meeting about it, but I just wanted to say hi to everyone, and hearing MSWs, um, hearing some people with MSWs there, that's great. Keep on going.
Felicity, we love you so much. And I didn't even realize that was the Felicity when you logged in. So what a special way to end this. So
Oh,
thank you so
thank
much.
you, Judy.
Thank you, Felicity.
Oh, you're welcome.
Mhm.
Have a good night.
Thanks. And students too, please keep in touch, because those postcards, those emails letting us know about you know, what you're doing next, or what job you took, or you know, if you got the job, if we wrote you a letter, we would love to know, did you get it? Did you get the job? That's always a nice thing to know too. Oh. All right, everyone. Well, I don't want to keep you, and it is a little bit earlier than we thought, but thank you so much for making this such a special night. If you did have a question that wasn't answered, or there is someone you need to keep and want to get connected to, feel free to email me at jearly, put it in the chat 3@uw.edu, and I can connect you. We also can have this recording made, it will be available, as well as the slides. So feel free to reach out, and thank you everyone for being here. And thank you, HSSA. We'll see you soon.
Thank you, everybody.
Bye.